All right, ready for a deep dive? Today, it's all about emergency medical technicians, EMTs for short. We're going to break down how they assess patients out in the field, using Chapter 10, Patient Assessment, from emergency care and transportation of the sick and injured. Got the audiobook and the learning outline right here.
Should be interesting to compare that with these national EMS education standard competencies slides, too.
Absolutely. Kind of see how the theory stacks up against the, official standards.
Yeah, it's more than just checking boxes, though, right? It's about how EMTs take what they know and make split-second decisions, often with limited information. Lives are on the line.
No pressure, right?
Yeah.
So for anyone listening who's ever wondered what goes on in the back of an ambulance, this one's for you.
We're going to get into the nitty-gritty of it all. The challenges, the complexities, everything that goes into being an EMT.
It all starts with assessment. We all know it's important, but
Yeah.
what makes it so crucial in the field where, like you said, time is critical?
Well, think about it. In a hospital, things are controlled. You've got specialist tests. Out in the field, it's a different story.
Yeah, you're dealing with the unexpected, right?
Exactly. Limited information, unpredictable situations. EMTs have to think on their feet.
So every second counts. They assess the situation and make critical decisions based on that initial assessment.
Exactly. And that's why having a systematic approach is so important. The textbook lays out a 5-part assessment: scene size up, primary assessment, history taking, secondary assessment, and reassessment, like a roadmap.
A roadmap for chaos, because I'm guessing things rarely go according to plan in an emergency.
You got it. That's where experience and judgment come into play. The textbook gives a framework, but the order of those 5 parts, it can change. Depends on the patient, the environment. Uncontrolled bleeding versus a sprained ankle, 2 different ball games.
Makes sense. Flexibility is key. It's not just about memorizing steps, but knowing when to adapt. Okay, before we get into the specifics of each stage, let's talk signs versus symptoms. I always hear those terms, but what's the difference? And why does it matter to an EMT?
So a symptom is what the patient tells you they're experiencing.
Yeah.
Subjective, right?
Mhm.
Dizzy, chest pain. A sign. That's
Yeah.
something you can actually observe. Objective, rapid pulse, pale skin.
So if a patient says, I feel lightheaded, that's a symptom. But if I, as the EMT, notice their skin is clammy, that's a sign.
Exactly. It's putting the pieces together, you see. Signs and symptoms combined help EMTs get a clearer picture of what's going on.
So they're not just treating the obvious, they're looking for those subtle clues that could point to something more serious.
Exactly. Now, you'll come across MOI and NOI a lot in the source material.
Right, right. Refresh my memory. What do those stand for again?
MOI, mechanism of injury. Crucial in trauma cases, car accidents, falls. You need to think about the forces involved, how they might have caused internal damage.
So MOI helps EMTs understand how extensive the injuries might be, even if they don't see everything right away.
Exactly. And then there's NOI, nature of illness. This is for your medical emergencies like heart attack, stroke, that sort of thing. Instead of external forces, it's about understanding the underlying medical condition.
Okay, so MOI for trauma, NOI for medical. What happens when it's not clear which one it is?
That's where things get tricky. The textbook gives the example of finding an unconscious patient at the bottom of a ladder. Did they fall and then lose consciousness? Or did a medical issue, like, say, a heart attack, actually cause the fall? Tough one.
Yeah, I can see how that would complicate the assessment.
Absolutely. EMTs have to consider all possibilities. Look at the scene, talk to bystanders, gather as much info as possible.
Like a medical detective, basically. Speaking of being prepared, I was surprised how much the source material stresses standard precautions. It seems like that's a huge priority no matter what.
Absolutely. Protecting themselves and the patient from infection, it's paramount. And it's not just about gloves and masks. We're talking eye protection, gowns, even helmets and turnout gear, depending on the situation.
Wow. They really never know what they're walking into. Safety first. So, once the scene is secure, where does the patient assessment actually begin?
It actually starts even before they touch the patient, forming a general impression.
So, observation is key. What are they looking for in those first few seconds?
Everything. The environment, the patient's position, how they look, level of distress, listening to their breathing, how they talk, or even if they don't.
Wow, that's a lot to take in. The textbook also mentions something interesting about making eye contact, using the patient's name. Seems simple, but I guess those little things matter.
It's about building trust. These patients are scared, vulnerable. Those small gestures go a long way.
Humanizes the situation. Okay, let's get into the primary assessment. This is where we get to the ABCs, right?
You got it. Airway, breathing, and circulation, the essentials. EMTs are trained to assess these quickly,
Yeah.
identify any immediate threats.
So making sure the airway's clear, the patient's breathing okay, and their heart's pumping.
Exactly. Looking for anything blocking the airway, listening for weird breath sounds, checking for a pulse, assessing skin color, temperature, things like that.
It's amazing, how much information they can gather in those first few minutes.
Training and keeping a cool head, it's crucial. But get this. The textbook also mentions that sometimes it's actually CAB, not ABC.
Oh, really? Why the change up?
Severe bleeding, like life-threatening. You got to control that hemorrhage first and foremost. Doesn't matter if the airway is clear and they're breathing fine. If they're bleeding out, nothing else matters.
Gotta stop the bleeding to buy time to fix the rest. Speaking of circulation, I gotta say, that part about pulse assessment, eye-opening.
You cut that bit about not using your thumb, huh?
Yeah, been doing it wrong this whole time. Why is the thumb a no-go for checking a pulse?
It's a common mistake. You see, your thumb has its own pulse, and it can be surprisingly strong, especially when you're trying to concentrate. Throws you off, especially if the patient's pulse is weak or really fast.
So I could be missing the patient's pulse because of my own thumb. Wow.
Exactly. That's why EMTs use their index and middle fingers, much more sensitive, less likely to, interfere.
The subtleties of EMT work. Okay, so we've got the pulse, but then the textbook goes on about skin being a window to circulation. What's that all about?
It seems obvious once you think about it, but skin tells you a lot about what's going on inside. Circulation problems, blood oxygen levels, even body temperature.
What should we be looking at specifically?
EMTs are trained to assess four main things: color, temperature, moisture, and capillary refill. Color's a big one.
Okay, say you see a patient with really pale skin. What's that tell you?
Paleness, or pallor, usually means poor circulation. Could be shock, where the body's trying to protect vital organs by, redirecting blood flow.
What about if the skin's bluish, grayish? That can't be good.
No, that's cyanosis. Means low oxygen in the blood. You'll often see it in the lips, fingertips, nail beds.
So pale for circulation, blue for breathing. Got it. What about other colors?
Redness could mean fever, high blood pressure, and then there's yellow, jaundice. That usually signals a liver problem.
It's like the body's sending signals, and you just have to know how to read them.
Exactly. Important to note, though, these color changes, they can be harder to see on patients with darker skin tones. EMTs know to look at places where the skin's thinner. Palms of the hands, soles of the feet, nail beds, even the inside of the eyelids and mouth.
Makes sense. You gotta adapt. What about skin temperature? Is that as telling as color?
Can be. Warm skin usually means good circulation, but cold, clammy skin, that's a red flag, especially with paleness. Could be another sign of shock.
The body trying to conserve heat.
You got it. And then moisture. Dry is usually normal. But if the skin's really sweaty, clammy, again, could be shock.
Okay, color, temperature, moisture. What was that last one?
Capillary refill. Quick and easy way to check the circulation in those tiny blood vessels near the skin.
How do you do that?
Press on the patient's fingernail or toenail. Let go. See how long it takes for the color to come back. Should be about 2 seconds.
2 seconds.
That's all it takes. If it's longer, could be poor circulation, dehydration, shock.
Simple but effective.
Yeah.
So we've covered the general impression, the primary assessment, focusing on those immediate life threats. What's next?
History taking. Basically finding out about the patient's medical background, what led up to the emergency, all that.
Important stuff, but talk about time pressure. Do EMTs really have time for a full medical history when every second counts?
True. Time is precious, especially if the patient's unstable. EMTs are trained to gather information fast, prioritize what's most important.
So what are asking?
Chief complaint.
Yeah.
Basically what's bugging them the most. Then they'll want to know, when did it start? How's it changed? Did anything trigger it? Any past medical problems, medications, allergies, recent surgeries, illnesses, that kind of thing.
Putting the pieces of the puzzle together. What if the patient can't talk? Like unconscious or too young?
That's when you got to get creative. Talk to family, bystanders,
Well,
look for medical alert jewelry, anything that might help.
resourcefulness.
Exactly. Use everything you've got to get the information you need.
Okay, so that's scene size up, primary assessment, and history taking. What's next in the 5-part process?
The secondary assessment. Time for a more thorough check, head to toe. Looking for anything that might have been missed in those first few minutes.
Going deeper, getting the full picture.
Right. How deep you go with this secondary assessment, it depends. Critically injured? Got to focus on those life-threatening injuries fast. If they're stable, you can be more methodical.
What does a typical secondary assessment look like?
Looking, listening, feeling. EMTs will check for injuries, signs of illness, anything out of the ordinary. They'll palpate, feel for any tenderness, swelling, and they'll use a stethoscope, auscultation, to listen to the heart, lungs, all that.
Those techniques, pretty standard in any medical exam, but I imagine out in the field the stakes are higher.
For sure. EMTs are looking for clues, trying to figure out how serious the situation is.
So after the secondary assessment, what then?
That's where reassessment comes in. The final stage, and you could argue the most crucial.
Reassessment. So they don't just assess once and they're done.
Nope. Reassessment never really stops. It's ongoing, from the moment they get there until the patient's handed off to the hospital staff.
Constantly checking for changes then.
Right. EMTs are always on alert, rechecking vitals, watching for new symptoms, seeing if those treatments are working.
That's a lot to manage, especially under pressure.
It is, but that's what makes EMTs so good at what they do. Staying calm, thinking clearly, adapting to the situation, all while being compassionate and caring.
Okay, so we've got our 5 parts of patient assessment. I'm curious, are there any interesting differences between how the textbook and the National EMS Education Standard Competencies slides approach this?
Good question. The textbook, Emergency Care and Transportation of the Sick and Injured, it's really good at breaking down the assessment process, step by step. Very detailed.
Sounds like a great resource for EMTs in training.
It is. Solid foundation. The National EMS Education Standard Competency slides are a bit different. They focus more on the big picture. The knowledge and skills an EMT needs, but not so much the step-by-step.
More about the overall competencies then.
Yeah, things like critical thinking, problem-solving, communication, teamwork, essential skills in emergency situations.
So you need both, really. The detailed approach of the textbook and the broader perspective of the competency slides.
They work hand in hand. Textbook gives you the roadmap, the competencies, and make sure you can handle whatever the road throws at you.
This has been really insightful. We've covered so much, from the initial scene size up to reassessment. But since we're really getting into the weeds here, I wanted to ask about that crucial period after a traumatic injury, the golden hour. Can you talk a bit about that?
Sure. The golden hour, sometimes called the golden period, basically highlights how important it is to get definitive care to trauma patients quickly.
What makes this hour so golden?
Well, severe trauma, it sets off a bunch of reactions in the body. Yeah. And if you can get that patient to definitive care surgery, life-saving interventions, that sort of thing, within the first hour, their chances of survival go way up.
It's a race against time.
Exactly. And EMTs, they're the ones who often get there first. How they assess, stabilize, and transport the patient, it can literally mean life or death.
Speaking of speed, the textbook mentioned the Platinum 10 minutes. What's that all about?
Speed is key. That's the ideal time frame for EMTs to do what they need to do on scene with a seriously injured trauma patient and get them moving to the hospital. Part of that golden hour, but those first 10 minutes, crucial.
Okay, so what needs to happen in those 10 minutes?
Scene safety, first and foremost. Can't help anyone if you become a casualty yourself. EMTs have to size up the scene, make sure it's safe.
Right, safety first. Then what?
Rapid assessment and stabilization. Figure out what's wrong, control bleeding, take care of airway and breathing issues, immobilize the spine if needed.
So much to do, so little time.
It's about working quickly but efficiently without compromising care.
A delicate balance. How do they do it all so fast? Is it just experience?
Experience helps, but it's more than that. Training, teamwork, and knowing what they're allowed to do, their scope of practice.
Can you elaborate on that a bit?
Sure. EMTs go through intense training to prepare them for making critical decisions under pressure. They learn how to function as a team. Everyone knows their role. And that scope of practice I mentioned, that tells them what procedures and interventions they're allowed to do in the field. Make sure they're giving the right level of care for each situation.
Knowing your limits, but also being ready for anything.
Exactly. That's what makes it so challenging, but so rewarding.
It really does. Well, as we wrap up this part of our deep dive into EMT patient assessment, I'm struck by the dedication of these professionals. They face such intense situations with such compassion and skill.
It's inspiring, for sure. Their ability to stay calm, make those critical decisions.
Every second counts, and the decisions they make in those first few minutes can change everything. It makes you wonder, though, how do they deal with the emotional and ethical challenges of the job, especially in those situations where they have to make really tough choices?
That's the thing about EMS. It's not just about the technical stuff. You're seeing people at their most vulnerable. And those decisions, they stay with you.
So how do they handle it? What kind of support do they have to deal with all that? It's this side of the job you don't often think about,
Yeah.
the emotional, ethical side of it all.
People forget EMTs are human too. They see some tough stuff.
Hmm?
And it's not always clear cut what the right call is.
So how do they deal with it? All that emotional weight.
Debriefings help. After a tough call, being able to talk it out with colleagues, mental health professionals, it makes a difference.
To process it all, get it off their chest.
Right. And having access to mental health care is huge. Therapy, counseling, stuff geared towards first responders.
People who get it, what they're going through. This has been eye-opening. I always knew assessment was important, but wow, the subtleties, the split-second decisions.
It's a whole different world out there.
We've covered so much ground. The whole 5-part assessment, the importance of those signs and symptoms, the golden hour, platinum 10 minutes, even the ethical stuff.
And who could forget those little details that make EMT work so unique?
Right. Like ditch the thumb when you're checking a pulse.
But that's skin. It's a window into what's going on inside.
It's clear. EMTs, they're highly skilled. They're out there on the front lines, literally saving lives. And they do it with compassion, resilience. It's remarkable.
It really is. And that brings us to our final thought for this deep dive. We've talked about how EMTs have to balance being thorough with being fast, especially in those critical moments. But where's the line between, quick assessment and potential bias? Does a patient's age, their background, even how they're acting, does that play into those split-second decisions? Something to think about.
That's a powerful question. Makes you think about the human element in all of this. Even the best training can't eliminate unconscious bias entirely. It's an ongoing discussion in the field for sure. And it highlights why it's so important to keep learning, to be self-aware, to make sure every patient gets the same quality of care.
Absolutely. At the end of the day, everyone deserves the best possible care, no matter what.
Well said. And on that note, we're going to wrap up this deep dive into the world of EMT patient assessment. It's a complex field, constantly evolving, and we have so much respect for the people who dedicate their lives to it.
Hopefully, you all listening have a better understanding of the vital role EMTs play and the incredible work they do every single day.
Until next time, everyone, keep asking questions, keep learning, keep exploring.